Welcome all for the today's class. So today we'll continue with pathology module, and our topic of discussion is tissue repair and wound healing. So tissue repair. So the definition is replacement of the damaged tissue by the regeneration or scar formation. Okay. So there may be regeneration or scar formation in the process of repair. So types of tissue repair. First is a regeneration. Regeneration is a replacement of the damaged cells by the cells of the same type. It results in the normal structure and function will be restored, and it will happen in the labile tissues, stable tissues with a preserved framework. An example is a liver generation or skin epithelial healing. Okay, so in regeneration you will get the function back. Okay, because there is a replacement of the damaged cells by the cells of the same type. While in fibrosis, what happens? Repair by fibrosis or the scar formation. It will occur when tissue destruction is extensive, extracellular matrix framework is damaged, and cells cannot regenerate. Result is a fibrous scar formation. Okay, so one of the important concept is the formation of the granulation tissue. Okay, so it is a specialized vascular connective tissue formed during the process of healing. So it appears within 3 to 5 days after the injury. Please remember the timeline. So it appears within the 3 to 5 days after the injury. Granulation tissue is a specialized vascular connective tissue. It is formed during the process of healing. Components of the granulation tissue: one, proliferating the fibroblast. Then newly formed blood vessels will be there, macrophages, inflammatory cells, and loose extracellular matrix. So these are the components of the granulation tissue. How does it look? The appearance, grossly it will look pink, soft, granular, while microscopy, it will have numerous capillaries, edematous stroma, and there will be fibroblast. Okay. So there is a angiogenesis, that is a neovascularization. This concept also we have seen along with the neoplasia. The same concept is here, angiogenesis or neovascularization. So the formation of the new blood vessels from the pre-existing vessels. The importance is it is essential for the wound healing, and it is important in the tumor growth also. Okay, so the concept of angiogenesis is important. What are the steps of angiogenesis? One is a basement membrane degradation. Second, migration of endothelial cells. Next is endothelial cell proliferation, and fourth is a maturation into the capillary tubes. Okay, so newly formed vessels are leaky in nature, and that is why the granulation tissue appears edematous. So when the new tissue develops, there is a neoangiogenesis, or the angiogenesis is there. These newly formed blood vessels are leaky. That is why the granulation tissue will look edematous. Okay, so what is the role of macrophages in the healing? The function is, when they cause removal of the debris, there is a they phagocytose the microorganisms, release growth factors, promote fibrosis and blanching of the wound. Okay, macrophages are the most important cells in the tissue repair. So mechanism involved in the repair are, there are various things are involved, like growth factors, then cell to cell interaction is there, then cell to matrix interaction is there, extracellular matrix synthesis happens, and the collagen deposition also happens. So mechanisms involved in the repair are, growth factors are involved, cell to cell interaction is there, cell to matrix interaction is also there, extracellular matrix synthesis will happen, and the collagen deposition. Okay, now growth factors in the wound healing. So various growth factors are involved. The epidermal growth factor is one of them. The function of the epidermal growth factor is a stimulation of epithelial cell proliferation and stimulation of the fibroblast. Then another very important factor is the platelet derived growth factor, PDGF. Okay, the source is platelet, macrophages, and the endothelial cells. So this PDGF comes from platelet as well as macrophages and endothelial cells. The function is a fibroblast proliferation, fibroblast migration, and smooth muscle proliferation. So PDGF is one of the earliest growth factors released after the injury. Okay, so you should remember this PDGF, which is one of the earliest growth factor released after the injury. Next is a fibroblast growth factor. The function of this is fibroblast proliferation and angiogenesis. Next is a transforming growth factor beta, that is TGF beta. The function is a fibroblast chemotaxis, collagen synthesis, fibronectin production, and it inhibits the epithelial proliferation. So TGF beta is the major fibrogenic cytokine, and this inhibits the epithelial proliferation. Okay, so there is a fibroblast chemotaxis, there is a collagen synthesis, there is a fibronectin production. But along with the epithelial proliferation is inhibited. Okay. Then next is a IL-1, and that is interleukin-1 and tumor necrosis factor. That will also stimulate fibroblast proliferation, increase collagen synthesis, and promote the fibrosis. Okay. Then there are certain growth inhibitors like TGF-beta. This we have seen. TGF-beta is a epithelial proliferation inhibitor. Okay. Then other is the interferons, prostaglandin E2 and heparin. These are the growth inhibitors. Okay. Then there is a cell-to-cell and cell-to-matrix interaction. The healing will be regulated by the contact inhibition, growth factor receptors, and the extracellular proteins. So important extracellular matrix components are the collagen, fibronectin, laminin, and proteoglycans. There are some integrins which are important. So these integrins are the cell surface adhesion receptors. Okay. They will, their role is mainly in the cell adhesion, cell migration, and signal transduction. Okay. So next component is a collagenization of the wounds. So collagen provides tensile strength to the healing wounds. It is produced by the fibroblast, and the basic collagen unit is the tropocollagen. Factors affecting the wound healing. So many factors will delay the wound healing, like infection, poor blood supply, foreign body movement, radiation. All these factors will delay the wound healing. Okay. While ultraviolet light will facilitate the wound healing. There are certain systemic factors which will also influence the wound healing, like age. Healing is rapid in the young age, whilst it is slow in the elderly. The nutrition will affect, like deficiency of protein, vitamin C, zinc, that will delay the healing. Vitamin C deficiency impairs the collagen synthesis. You should remember from SBA point of view. Diabetes mellitus causes increased infection, poor vascular supply. Result is a delayed healing. Then hematological disorders such as neutropenia, bleeding disorders, that will also lead to the poor healing. Then skin wound healing. What are the phases of the skin wound healing? Okay, so these phases also you should remember. In certain books, they have given 3 phases, while in certain books, certain authors have used 4. Okay, so the first is a hemostasis, second is the inflammation, third is the proliferation, and fourth is the remodeling or maturation. Okay, so wherever there are 3 phases which are described, the hemostasis is combined along with the inflammation, because both are the earlier response after the wound. Okay, so hemostasis and inflammation can be combined together. Okay, so first phase is a hemostasis. It occurs immediately after the injury. Okay, so mechanism is a platelet aggregation and fibrin clot formation. The platelets will release PDGF and the cytokines. So that is the hemostasis phase. Second is an inflammatory phase. So here you will get all 5 features of this. That is the redness, swelling, heat, pain. Okay, so the duration is up to 4 days. Okay, so classical signs will be there, and inflammatory phase will last up to 4 days. Then there is a proliferative phase which will start around day 4. The feature will be formation of the granulation tissue, fibroblast proliferation, and angiogenesis. This proliferative phase will prolong. It will last almost up to 3 weeks. Then there is a remodeling and the maturation phase. It will take long time, from months to the years. There is a collagen remodeling, scar contraction, increased tensile strength, etc. Okay, so remodeling may continue for even up to 2 years also. Okay, so what are the important steps of wound healing? There is a hemorrhage and exudation. There is acute inflammation, scab formation, macrophage will clean up, then organization, epidermal proliferation, wound contraction, synthesis, collagen deposition, and scar maturation. So these are the important steps of the wound healing. Okay, now there are differences between the healing by the primary intention and the healing by the secondary intention. Okay, so these concepts you should understand, because SPS can be asked on these concepts, primary intention and the secondary intention. So healing by primary intention, the healing of clean wounds with approximated ages. Example is a surgical incision. Features of primary union will be minimal tissue loss, minimal granulation tissue, minimal scar, and the rapid healing. So these are the characteristics of primary union. The timeline for primary healing also you should know. So within 24 hours, neutrophil will appear and the epithelial proliferation begins. So in the primary intention, within 24 hours, neutrophil will appear and epithelial proliferation will begin. By 72 hours, macrophage will predominate and the granulation tissue will form. By day 5, collagen bridges incision and epidermis will thicken. By 1 month, mature scar will be formed and inflammation will disappear. Okay, so these are the timeline in the process of the healing by primary intention. Now, healing by secondary intention. Here, healing of large wounds with extensive tissue loss is there. Example like ulcer, abscess cavities, large traumatic wounds, etc. So, what are the features of secondary intention healing? There is a extensive inflammation. There is a abundant granulation tissue. Large scar will be there. Slow healing and the wound contraction. Okay. So, what is the mechanism of wound contraction? It is the myofibroblast activity. It reduces the size of the wound. Then myofibroblasts are responsible for the wound contraction. So we'll see the differences between the primary intention healing and the healing by secondary intention. So in primary intention, tissue loss is minimal, scar form is minimal, granulation tissue is minimal, healing speed is rapid, and wound contraction is also minimal. While in secondary intention, there is an extensive tissue loss, large scar, there is abundant granulation tissue, healing speed is slow, and wound contraction is marked. So these are the differences between the primary and secondary intention healing. Then what are the complications of wound healing? One, there is excessive granulation tissue, which is described as a proud flesh. The granulation tissue protrudes above the wound and it prevents the epithelialization. Okay, sometimes there is a granulation tissue. Even we notice in the episiotomy also. Okay, actually for a part 3 MRCG there is a separate task on this excessive granulation tissue. Okay, then keloid formation. So excessive collagen deposition causes raised scar. It is common in dark skin individuals. Difference from proud flesh is that it is due to the excess of collagen and not due to the granulation tissue. While in excessive granulation tissue, the granulation tissue protrudes above the vein. There is a more of the granulation tissue which is getting formed. While in keloid formation, it is due to the excess of collagen and not because of the granulation tissue. Next is a wound rupture or the dehiscence. It is the failure of the wound edges to unite. Next complication is epidermoid cyst. The cause is implantation of the epidermal cells into the dermis, resulting in keratin-filled cyst. Next complication is infection. The features are the pus formation and the delayed healing. Next is a weak scar formation. It may be due to poor collagen synthesis, malnutrition, infection. Okay. So from examination point of view, we should remember granulation tissue appears by day 3 to day 5. Macrophages are essential for wound healing. VEGF, that is vascular endothelial growth factor, and fibroblast growth factor promote angiogenesis. TGF beta stimulates fibrosis and the collagen synthesis. Vitamin C deficiency impairs collagen formation. Myofibroblast cause wound contraction. Then primary healing is with minimal scar. Secondary healing will lead to the large scar plus contraction. Keloid is because of the excess collagen deposition, and PDGF release early from the platelets. So these are the important points from this tissue repair and regeneration. Okay, so we finished this particular topic. Thank you. We have few questions, Doctor. Dr. Sansi, can you please go through these questions now?
Yes, sir. A 62-year-old woman with poorly controlled diabetes undergoes abdominal surgery. On post-operative day 5, the wound edges are erythematous with purulent discharge. Which phase of wound healing is most directly impaired by this complication? Hemostasis, inflammatory phase. Wound edges are erythematous with purulent discharge. Okay. Hemostasis phase, inflammatory phase, proliferative phase, remodeling phase, epithelial maturation. Remodeling phase.
I don't think remodeling will be there. Dr. Monica, what you say?
Proliferative phase.
Proliferative
Tissue formation.
See the case of poorly controlled diabetes, and she is undergoing abdominal surgery, and it is a post-operative day 5. The wound edges are still erythematous with purulent discharge. Okay, so it is a proliferative phase. So infection interferes mainly with the granulation tissue formation, fibroblast proliferation, collagen deposition, and angiogenesis. All key events of the proliferative phase, diabetes predisposes to infection and delayed healing. Okay, continue, Dr. Sansi.
A patient develops a raised scar that extends beyond the boundaries of the original wound several months after ear piercing. Which of the following best explains the lesion? Excessive granulation tissue formation, delayed epithelialization, excessive collagen deposition, defective angiogenesis, persistent fibrin clot. Sir, option C, excessive collagen deposition.
Yes, so we have seen the difference between the excessive granulation tissue and the keloid. Okay, so here we are talking about the excessive collagen deposition because raised scar is there. Okay, beyond the boundaries. So there is excessive collagen deposition. A keloid results from excessive collagenization during the wound healing. Unlike hypertrophic scars, keloids extend beyond the original wound margins and are more common in darker skin individuals. Continue, Doctor.
Which growth factor is primarily stored in platelet alpha granules and stimulates fibroblast migration and proliferation during wound healing? Epidermal EGF, tumor necrosis factor alpha, interleukin 1, PDGF, platelet derived growth factor, TGF beta, transforming growth factor beta. Sir, option E, TGF beta.
Which primarily stored in the platelet alpha granules and stimulates fibroblast migration?
Last
Is it TGF beta?
PDGF, option D.
PDGF.
Option D. Yes.
PDGF. Okay. So platelet derived growth factor is released from activated platelets early during the wound healing and promotes fibroblast proliferation, migration, smooth muscle proliferation, and angiogenesis. Next.
A pathologist examines tissue from a healing wound and notes numerous newly formed capillaries with leaky endothelial junction, proliferating fibroblasts and macrophages. Which term best describes the tissue? Fibrinoid tissue, necrotic tissue, granulation tissue, hypertrophic scar, or fibromatosis? Sir, option C, granulation tissue.
Yes, it is a typical description for the granulation tissue. Okay. So the answer is a granulation tissue is a composed of proliferating fibroblasts, inflammatory cells, and new vascularization. Newly formed capillaries are leaky, making it edematous. Continue, doctor. Next question.
A 25-year-old man sustains a clean surgical incision closed with sutures. Which event is expected approximately 24 hours after injury? Maximum collagen deposition, wound contraction by myofibroblast, neutrophilic infiltration and epithelial migration, completely epithelial regeneration, scar blanching. Sir, option C, neutrophilic infiltration.
Yeah, because we are talking about 24 hours, immediate first 24 hours. So first 24 hours, neutrophilic infiltration and epithelial migration. Okay. Here, as I mentioned, a few authors will combine hemostasis along with the inflammatory phase. Okay, so neutrophilic infiltration plus epithelial migration. So in primary intention healing, neutrophils appear within 24 hours and epithelial cells begin to migrate beneath the scab to breach the wound. Okay, continue the next one.
Which of the following best characterizes healing by secondary intention? Minimal granulation tissue formation, absence of wound contraction, healing with closely approximated edges, extensive granulation tissue and wound contraction, rapid restoration of tensile strength. So option D, extensive granulation tissue and wound contraction.
Yes, it is the extensive granulation tissue. Extensive granular tissue and wound contraction. Secondary intention healing occurs in large wounds with tissue loss. It is characterized by abundant granulation tissue, intense inflammation, and contraction mediated by myofibroblast. Dr. Monica, you want to continue few questions?
Yes, sir.
Yeah.
Question number 7. A researcher studying angiogenesis identifies the first step in formation of new blood vessel during the wound healing. What is the initial step? A. Endothelial proliferation. B. Maturation into capillary tubes. C. Migration of endothelial cell. D. Basement membrane degradation. And E. Fibroblast activation.
Angiogenesis, first step.
Angiogenesis.
Angiogenesis. Any guess?
So endothelial.
No, a basement membrane degradation, option D.
Yes. See, what happens? They will new angiogenesis, new blood vessels will form from the existing blood vessels. Okay, so there will be a degradation of the basement membrane. Then there will be endothelial cell proliferation, and then for the new vessels will be formed. So the first is a basement membrane degradation. Angiogenesis begins with enzymatic degradation of the basement membrane of the parent vessel, followed by endothelial migration, proliferation, and then tube formation. Okay, continue, doctor. Next.
A patient is receiving prolonged glucocorticoid therapy, develops a delayed postoperative wound healing, which is the mechanism most commonly explain this effect. A. Increased fibroblast proliferation. B. Enhanced collagen synthesis. C. Suppression of inflammatory response. D. Excessive angiogenesis. And C. Endothelial increased epithelial regeneration. So enhance collagen synthesis.
Doctor, glucocorticoid therapy, they are anti-inflammatory in nature, no?
Suppression of inflammatory
Option
response.
C.
Glucocorticoids will suppress the inflammation and inhibit fibroblast activity and collagen synthesis, thereby impairing wound healing. Okay. So normally, glucocorticoids, that is the one of the common action which we know. Continue with the next one.
Which of the following cells is primarily responsible for wound contraction during the secondary intention healing? A. Neutrophils. B. Endothelial cells. C. Macrophages. D. Myofibroblast. C. Keratinocytes. So option D. Myofibroblast.
Correct. D option, myofibroblast. Okay. So myofibroblast are modified fibroblast with contractile properties responsible for reducing wound size during secondary intention healing. Continue, doctor. Next.
A patient with severe vitamin C deficiency develops a poor wound healing and bleeding gums. Defective synthesis of which of the component is primarily responsible? A. Elastin. B. Fibronectin. C. Fibrin. D. Collagen. And E. Laminin. So collagen
Yes,
because
vitamin C
vitamin C.
deficiency. Yeah, vitamin C deficiency will lead to collagen deficiency. Okay, vitamin C is essential for hydroxylation of proline and lysine during collagen synthesis. Deficiency leads to impaired collagen formation and defective wound healing. Okay, so actually all this is from our paraclinical knowledge. Sometimes the same question can be asked from the biochemistry point of view on the proline, lysine, etc., etc. Okay, so this same information which we need to know. Okay, so that finishes the today's topic of tissue repair and the wound healing. Thank you, doctor.